Today we're going to be doing a hot stone massage on the back, and I'm going to be guiding you through all the steps that I take as we're using the hot stones. Okay, so I usually pull 4 hot stones out at a time. I'll leave the other 4 in there for right now. Use a wooden spoon because the water can get pretty toasty. And the thing with the rocks is the larger ones hold more heat in them, so I try to use the smaller ones first. All the rocks that I'm using today are basalt rocks, which are, in other words, just river rocks. So I'll pull those out. I'm gonna let them cool off for a second. So I'm gonna lotion the back first before putting the rocks on, because the rocks do tend to just soak up some of the lotion and the oil as we're using it. So you wanna give a good chunk on there. Right, and you grab 2 rocks to start out with. Typically 2 of the smaller rocks. A nice big deep breath in and slowly out. And they can be pretty hot at first when coming out, so you want to use them nice and quickly on the back to disperse some of that heat. So I'm going to start on the low back, and then we'll come up and work on the upper back. Right, and those have reached a point where you can adjust warm, so I'm going to plop them back in the water. And I'm going to grab one of the other rocks. I'm just going over the erectors, then coming down and working on the top of the glute med and his attachment at the top of the hip here. And I'll typically leave the stone there, keep the back nice and warm in the area. I just want to work on heating up the area before you really get in there. Let the muscle loosen up a bit. Right, I'm getting to a bit of the glute attachment on the hip. So I'll just grab the rock and nice and lightly go over that attachment through here. I find the glutes, when they're really tight, can pull on the low back. So that's why I just like to work right through here, and then it's still accessible with the back drape. So we'll start on the other side. Now, one way I like to do a quick transition from one side to the other is kind of getting into QL a little bit, or quadratus lumborum, and I'm gonna bring the rock from the top of your iliac crest through with the rock. I kind of lightly pull over. How's that feel? I find a lot of people get relief from it. Using actual rocks, they're all different shapes, so you kind of gotta adjust your grip in different ways while still applying pressure. There's some rocks, as weird as it is to say, that you'll find are your favorites. In comparison to others, there's some that hold heat a little bit longer than others. If there's a bit of iron in the rock, then those tend to be a little bit warmer than, say, just a normal basalt rock. I'm just doing the same thing that we did on the other side. The whole idea is that the heat from the rock is transferring into the skin, into the muscles of the person. When you get used to the rock, you can kind of feel where there's a little bit of muscle resistance. So it's almost like this spot just feels little bit harder, a little bit tougher, and you can push in a little bit more as long as the patient can handle it. And you'll find that with the heat, with the pressure, it just releases so much faster. So for the next part, we're gonna be coming up to the upper back, working through there. Just pulling out a few fresh stones. So we're working over the erectors on your T-spine and over the rhomboids. I'll come up and work over your trap and left scap attachments as well. Idea is just heating it up before we get in there a little bit. You can feel she has some knots or trigger points on this side. We'll get in through there. There's definitely some hypertoned muscles as well. And grab the other rock and we'll leave that rock there. It's only warm. So this one I like because it is such an odd shape. I can kind of get in there a little bit more into her shoulder blade and come around, follow those muscles. I feel a tight little area. I'm just gonna kind of push and retract, or some might call it frictions. So a little bit of a hypertoned area right here, a little bit of a trigger point. I'm just gonna hold it with the rock. I know the rock's not super hot, it's warm at this state, so it's not gonna burn her. You can see from the heat the vasodilation in the area, and the heat just allows the muscles to relax with the pressure. Using the rocks in a therapeutic manner, we're basically working with the rocks and the heat and the pressure, and it is relaxing, but allowing some deeper pressure is a little bit more of a therapeutic treatment in this sense. Working on a little bit more of a specific area. Coming up to the trap, warming it up before I get in there a bit. Right. When the rocks are a little bit hotter when you initially pull them out, you're still gonna wanna do that first initial step that we had, which is dispersing the heat, moving it nice and fast, disperse the heat. Patients still get that warmth from the rock, so just feeling that those attachments are a little tighter in here, so I'm just going over them a little bit slower, using the heat, using some pressure in the rock. Doesn't need to just have one hand on the rock, you can use both. Remembering to flip because the side against the skin is going to cool down faster than the side that's up in the air because it's releasing that heat into the body. Just moving the stone into this attachment site. The stone's a little bit flatter rock, so I can dig into the side of the blade where the rhomboids are going through and kind of press in a little bit, and that's a trigger point hold. I'm just waiting for those muscles to release. And there we go. A little bit more aggressive than I was expecting, but that's okay. Yeah, and that's a lot smoother in through here. So now I can actually glide the rock without feeling it being all bumpy and rough, and just the hypertone muscles just completely released with that one. All right, now we're gonna come up to this trap here, warm it up. So her love scap attachment right in through here, it's so tight. Our goal is to release that. Every time I go over it with the rock, I can feel a little pop of the attachment at the superior angle of the scapula. Just want to check in every once in a while, make sure it's not too hot. As much as it might not be too hot in your hand, doesn't mean it's not too hot on their skin. I'm gonna go in there, let me know if this is too much pressure. Again, just using that little bit of a friction motion with the hot rock, getting in there. And hold. And you can feel the one part just releasing below the pressure. Way less bumpy now. There's not so much of that snapping motion in there. There we go. And that last hold, just let it all release through there. And I would repeat the same thing on the other side. Be able to move that rock nice and smoothly now. It can be a little uncomfortable sometimes when you're having to hold that trigger point, but having that relief and that release of the muscle is so worth it. A little bit of uncomfortability for a longer term gain.